Hi, I'm Dr. Sharon Dunagan, and I'm the chiropractor here at Massage Bliss in Cryo in Sachse, Texas. And just wanted to take some time today to answer some questions that you might have about chiropractic. Many chiropractors use different chiropractic techniques to treat their patients. I myself use diversified, activator, drop techniques, as well as flexion distraction to treat my patients. Most people want to know if the adjustments hurt. They shouldn't hurt. However, most patients on their very first time do experience some general soreness after they've been adjusted because we've moved things around. It shouldn't hurt as an ongoing process. So, and if that's the case, then other things need to be done, like perhaps referring you for an x-ray or an MRI, something like that, if you're not responding to the care that you're receiving. Most people have asked what the popping noise is all about, and in a nutshell, to answer that question, it is nitrogen gas being released out of the joints at the end of what's called joint play. What that means is that we push that joint as far as it's going to go, and then it pops. And it's the nitrogen gas being released out of that area. So when you come first, call to make an appointment to see the chiropractor. Some of the things that you want to experience is obviously you'll be greeted at the front desk. You'll have a packet of paperwork to fill out. Yes, the lovely paperwork. Then from there, you'll be taken back to the doctor's office where we'll have what's called a consultation. What the consultation allows me to do is get a complete history, find out, what your, health conditions are, what kind of past history you've had, what your injury is, what your complaint is, pain levels, and then we can kind of decide from there if this is the right place for you or if you need to be referred to someone else. During your exam, we will do check your ranges of motion in both your neck and your lower back. We will do some orthopedic testing to see if we're dealing with a pinched nerve or a herniated disc or some other health condition. Your blood pressures will be taken to make sure that everything is good to go prior to getting an adjustment. Chiropractic care can help with several different conditions and not just neck and back pain. Headaches, asthma, high blood pressure, diabetes, things like that getting adjusted can help with those things by simply correcting the subluxations and freeing up those nerves that travel to those end organs. Most people ask if it's appropriate for children to have chiropractic care, and the answer is yes. I see children anywhere from babies all the way up, mostly for, because they've fallen or, they're just, rough and tumble, sports injuries, things like that. I see a lot of kids that have ear infections. We always talk with our pediatrician first to make sure that it's okay for them to get adjusted. And then when I see them, then we always adjust them either with the activator or with diversified techniques to make them feel better. We do not take insurance here in this practice. The first visit is $25. After that, we can discuss your treatment plan on an individual basis and come up with how many treatments you're going to need and what that cost will be.